student nurse from Camarines Sur Polytechnic Colleges. So for today, I am going to demonstrate the assessment of the head and neck of the patient. So without further ado, let's get started. And for this assessment, I am going to assess the structures and functions of the head and neck and the risk factors of the head and neck disorders across cultures and ways to reduce one risk, and to determine the normal and abnormal findings of the head and neck. And this assessment of the head and neck focuses on the cranium, face, thyroid gland, and the lymph nodes and structures connected within the head and neck. Then next is the preparation knowledge of the assessment of the head and neck. So we need to describe the structures and functions of the head and neck. So it is focuses on the cranium. These are the bones that form the head, and it is made up of cranial bones. Cranial bones, these are the bones that surround and protect the brain, and the facial bones. Facial bones, these are the bones that form the eye, nose, cheek, and jaw. So cranium, it is where the spinal cords connect to the brain. Then next, the thyroid gland. The thyroid gland, it is the largest endocrine gland in the body, and it is produces thyroid hormones that increases the metabolic rate of most body cells. And it is surrounded by several structures like the trachea, thyroid, thyroid cartilage, the cricoid cartilage, and the hyoid cartilage. Then next is the lymph nodes and structures. It is surrounded by a connective tissue capsules and into the compartment called the lymph nodules. Then next, we need to describe the major types of the headache. So we have the sinus headache, cluster headache, the tension headache, and the tumor-related headache, and the migraine headache. So then next, we need to describe the age-related changes of the face and temporal arteries. Then next, gather all the equipment. So the things that I am going to use is the a glass of water for the thyroid examination. Then next is the stethoscope for auscultation. Then next, lastly, is the clean gloves. So then next, introduce yourself to the clients and verify the client's identity. So, good day, ma'am. I am Jamanakinas Alvis, your student nurse from Camarines Sur Polytechnic Colleges. So, ma'am, I'm going to verify your identity. Ma'am, can you please state your first name, middle name, and then your surname?
My name is Nicole Rigaspi Sasalvia.
Then how about your birth date, ma'am?
My birthday is on July 19, 2003.
Okay, then how about your age, ma'am?
I am 18 years old.
Okay, then next, explain the procedure to the clients and why it is necessary and how the clients can cooperate. So, I'll just explain the procedure to you, ma'am. So, I'll be assessing your head and neck, and for me to be able to assess, I'll be able to touch you to the certain parts of your body, particularly in the head and neck. So, is that okay with you, ma'am?
Yes po.
Okay, then rest assured that all the documents and the findings are completely confidential between me and the attending physician. And do you have any questions, ma'am?
None so far.
Okay, thank you, ma'am. So, ma'am, I'm going to ask you what is language is comfortable with you, ma'am.
May dialect na lang po.
Okay. Okay po, and I'm going to start, ma'am. I'll just have a quick history about you po, ma'am. Are there any lesions or lumps in the head and neck niyo po?
Wala naman.
Okay. May mga lumps po ba kayo or mga bukol na or masses?
Wala po.
Okay. How about, ma'am, sa difficulty? Hirap po ba kayo sa pag-move ng head and neck niyo po?
Hindi naman po.
Okay. Then how about po, ma'am, sa facial head and neck niyo po? Meron po ba kayong frequent headache po?
Sometimes po.
Okay, I'll take note on that. Then, ma'am, nahihilo po ba kayo minsan or nawawalan po ba kayo ng malay?
Hindi naman po.
Okay. Okay, ma'am. Then, how about po, ma'am, sa past history niyo po? Are you, and there are any previous head and neck po ba? Problems like trauma or injury po?
Wala po.
Okay, sa family history niyo po, meron po ba sa family niyo nagkaroon ng head and neck cancer?
Wala naman po.
Okay. Then, how about po, ma'am, sa lifestyle and health-related practices niyo po? Nag-smoke po ba kayo, ma'am?
Hindi po.
Okay. Then, ma'am, do you wear a hat po or helmet po?
Kapag sasakay ko ng mga motorcycles.
Okay, I'll take note on that. Then, ma'am, sa pagtulog niyo po, ma'am, ano po ang typical posture niyo po kapag natutulog?
Prone position po.
Okay, thank you, ma'am. Then, how about po, ma'am, sa recreational time niyo po? Ano pang ginagawa niyo kapag free time niyo?
Mostly po nagsa-cellphone lang.
Okay, thank you, ma'am. Then, observe appropriate infection prevention procedures. Then, okay, ma'am, I'll perform the assessment na po. But before that, I am going to perform the hand hygiene to prevent the transmission of microorganisms from one patient to another. Then next, provide the client's privacy. So, let's just assume that I already closed the curtain and then the door. Then I'm going to wear now the gloves. So first, we're going to put this to our dominant hand. Okay, ma'am. So for our first part of our assessment, I am going to inspect your head and palpate your head. So, okay, ma'am, I am expecting for your
Face.
for the size, shape, and configuration. Okay, then next, ma'am, I am going to palpate your head for consistency. So I'll just check your scalp too, ma'am. So, ma'am, can you please remove your clip? Okay, thank you, ma'am. Okay, ma'am, I'll just inspect from the back naman po, ma'am. Okay, ma'am, so I have, okay, ma'am, I have observed that your head is symmetrical and it is broad and erect, and your ma'am normocephalic. It means that your head is appropriate to your body, and I don't see anything lesions po or lumps in your head po, and I don't also see any presence of parasite like lice po. Okay, okay, ma'am, I'll be inspecting your face for symmetry, movement, features, expression, and skin condition. So, ma'am, I'll be checking your facial symmetry and facial movement symmetry. Okay, I'll just observe lang po, ma'am. Next, ma'am, I'm going to check the cranial nerve number 7, which is the facial nerve. So, ma'am, can you do the things that I'll tell you to do so? Okay, then, ma'am, can you please raise your eyebrows po? Lower po, ma'am. Okay, so, ma'am, can you please blink your eyes po? Okay, ma'am, thank you. Then, ma'am, can you please blink, close your eyes tightly like this po? Okay, thank you, ma'am. Then, ma'am, can you please smile po? Okay. So, ma'am, can you please pump your cheeks po like this? Okay, ma'am. So, then next, ma'am, I'm going to palpate your temporal artery for tenderness and sensation. So, I'll be checking your temporal artery, ma'am. So, allow me to touch you again. So, okay, ma'am. So, ma'am, can you please bite your teeth po? Okay. Release po, ma'am. Okay. Then bite again, repeat, ma'am. Okay. Then release po. Okay. Bite, repeat again, ma'am. Release po. Okay. Then next, palpate for the temporomandibular joint for the range of motion, swelling, tenderness, or precipitation, and by placing the index finger over the front, then ask the client to open the mouth. So ma'am, I'll be checking your temporomandibular joint. So ma'am, allow me to touch you again. So, okay. So, ma'am, can you please open your mouth po? As wide as you can po, ma'am. Okay. Then close your mouth po, ma'am. Then open your mouth again, ma'am. Close po. Okay, ma'am, I haven't seen any swelling po. And di naman po ako naka-observe ng any clicking while doing it po. And while checking your temporal artery and your temporomandibular joint. So, ma'am, do you nakaramdam po ba kayo ng discomfort po? Like pain po or tenderness? Wala naman. Okay. Then next, ask the client for frequent headache. So, ma'am, nakaramdam po ba kayo ng frequent headache this past few days po? Okay, ma'am, thank you. The next part of our assessment, I'll be assessing the neck. So, ma'am, I'm going to assess your neck po. Okay, I'm just observing po. Then next, inspect the neck while it's slightly flexed. So, okay. So, ma'am, can you please sip a small amount of water po? Then, pag ganyan niyo po ng water, hold niyo lang po muna sa mouth. Okay, thank you, ma'am. Then next, inspect for the movement of the thyroid and figured cartilage and the thyroid gland by having client swallow a small sip of water. Okay, so, okay po, I have seen that your trachea is in the middle line and nung lumunok po kayo, okay lang din naman po yung naging process. Ang lag-up po yung dito sa part nyo po and that is normal po. And I don't see any swelling naman po pagdating po sa neck na po. And ma'am, nung nagsip po ba kayo, nakaramdam po ba kayo ng pain or tenderness? Wala naman. Okay, ma'am. Okay, ma'am, nagka-problema po ba kayo sa pang-swallow nyo po? Hindi naman po. Okay, thank you, ma'am. Then next, inspect for the cervical vertebrae by having client flex neck. So, okay, ma'am, I'll be checking your cervical vertebrae. Posteriorly ko po siya i-assess. So, ma'am, can you please remove your teeth po? Okay, thank you. So, dito ko po siya i-assess. So, ma'am, can you please look side po? Okay, angat po. Thank you, ma'am. Then, sa kabilang side naman po. Okay, angat po. Okay, side naman po. Okay, side naman po. Okay, ma'am, I don't see any irregularities naman po nung ginagawa niyo po yung procedures. Then next, inspect for the range of motion of the patient by having the client turn chin to the left and right shoulder, then the touch ear to the shoulder, then turn chin to the chest and lift the chin to the ceiling. So, ma'am, I'm going to check the range of motion of your neck po. So, okay, ma'am, can you please turn your chin side to side po? To side. Okay. Okay. Okay, ma'am. Then, how about, ma'am, can you please touch your ear to your shoulder po? Like this. Okay. Okay, thank you, ma'am. Then, ma'am, can you please turn your chin to your chest po, like this? Then, lift chin to the ceiling po, like this. Okay. Thank you, ma'am. Then, ma'am, did you feel any tenderness po or pain while doing the procedure? Okay, thank you, ma'am. Then next, palpate the trachea by placing the finger to the sternal notch, feeling each side, then palpate the tracheal wings. So, Ma'am, I'll be palpating your trachea po and posteriorly ko po siya i-assess. Okay, ma'am, I'm gonna touch your trachea po. And I'm going to palpate and observe po. Ma'am, can you please look at me? So, ma'am, posteriorly ko po siya i-assess. So, I'm gonna palpate po and observe ko lang po yung trachea niya. Okay, I can clear naman po na nasa middle line po siya. Okay, ma'am, how about ma'am, can you please swallow po? Okay, then again, ma'am. Okay, then last, ma'am, swallow po. Okay, ma'am. Okay, ma'am, I can see that your tracheal veins are working po and okay naman po yung naging pag-swallow niya. And okay, ma'am, can you please face the ring po? Then lift up your chin po. Okay, then side to side po. Side. Okay, okay, nasa middle line naman po yung trachea niya. Then next, auscultate the thyroid gland for growths if the gland is enlarged. So, okay, ma'am, I'll be auscultating your thyroid gland if there are any presence of growths. Ma'am, can you please inhale po? Huwag mo lang po yung button. Okay, exhale. Inhale. Exhale. Inhale. Exhale. Okay, ma'am, I can see that there are no presence of roots and your carotid artery are functioning well. Then for the last one, I'll be palpating for the lymph nodes. So, ma'am, I'm going to touch your face again, ma'am. So, okay, so right now, I'll be palpating for the preauricular nodes. Okay. Okay, then next is the postauricular nodes. Then next is the occipital nodes. Then next is the tonsillar nodes. Then next is the submandibular nodes. Submental nodes. Then next is the superficial cervical nodes. Then next is the posterior cervical nodes. Then next is the deep cervical chain nodes. So, then lastly is the supraclavicular cervical nodes. Okay, ma'am, did you feel any discomfort po or tenderness or pain po while doing the procedure? Okay, thank you, ma'am. So that concludes my demonstration of the assessment of the head and neck.